I'm Jude, and here's my audience. Most people think phobias are fear of something, and they use it commonly. It's a commonly used term in everyday life. But dictionary.com says a phobia is a persistent, irrational fear of a specific object, activity, or situation that leads to a compelling desire to avoid it. And it is a type of anxiety disorder, and it's not termed a phobia unless the fear of something interacts with or interferes with your everyday life. So just being afraid of something just commonly is not a phobia. Phobias usually pose no danger, such as hydrophobia, which is the fear of water, and acrophobia, which is the fear of heights. But Squidoo.com has some listed common phobias, such as claustrophobia, which is the fear of being in tight places, arachnophobia, which is the fear of spiders, and social phobia, which is the fear of being around a large group of people. And that's more than being shy. It's like you think something's bad going to happen when there's a bunch of people in a small space. They also listed some uncommon phobias. Nephophobia is a fear of clouds. Phobophobia is a fear of developing a phobia. And octophobia is the fear of the figure 8. And ironically, there's a phobia or a fear of long words, and the name for it is 36 letters long, so if you have a phobia of that, you're not going to want to hear that you have a phobia of it. People with phobias, they try to avoid their fear, and if they can't, they have symptoms that can tell you have a phobia and not just a fear. If they encounter the thing they have a phobia for, they may experience panic, trembling, shortness of breath, and or rapid heartbeat. And the treatment for these, well, first of all, if you have any of these symptoms, then you know you have a phobia, and you should go to the doctor to let him tell you really have a phobia. The treatment can be medication prescribed by a doctor or therapy, and sometimes people use both of these to treat their phobia. Phobias can probably be cured if you do treatment enough and you overcome the fear of whatever you're afraid of. And thank you.